the other advantage of the vaccine is that efficacy expands when the greater population gets vaccinated. That's called herd immunity. Herd immunity is when a large proportion of a population is vaccinated. So, for example, we have a room of 100 people. Okay, if 70 to 80% of those people are vaccinated and the virus enters that room, it has a less chance of infecting 20% of unvaccinated people, which is 20, versus if only 10% of that room is vaccinated, there 90 people are at risk. And then when those people leave those rooms, they're spreading it. That's why we're in this pandemic. So if we can establish herd immunity in this country, which means more and more people get vaccinated, this virus, COVID-19, peters out. We saw that in the 50s with polio. Okay, polio does not exist in this country because a large portion of the population was vaccinated at that time, virtually everyone, and the virus petered out. Okay, but even the polio vaccine at the time was not 95% effective. People were still getting polio until that actual herd immunity happened. And that's what's going to get us out of that this pandemic. Otherwise, the virus will continue to circulate in our communities, in our country, in our world, until it actually mutates. And we've all heard about some variants, and we don't want that to happen.
So just to add to that, there are 332 million people in the United States. Approximately 80% for herd immunity would be some of the neighborhood of 250 to 260 million. We've had, 150 million or so vaccinated at this point, about 130. We've had about 40% or so that are fully vaccinated. So we need that number to be quite a bit more. We do have a certain percentage of people that have developed some natural immunity from having the disease itself, maybe 35 million or so. But then there's some overlap of people that have been vaccinated after having the disease. So that total number is probably not 180 million yet. But it's going to take another 3 to 6 months to get the number we need to get vaccinated to get herd immunity to happen, most likely. So we would still want to push for more and more people to be vaccinated.
And if we take our smaller population of roughly 37,000 people in Williams County, quick math, herd immunity would take to be 70 to 80%, probably about 32,000 people in this county. We've done a great job in vaccinating the people 65 and up, which are the highest risk population. We've reached a goal of close to 70 to 75% in vaccination in that age group. There still are some out there that can still be vaccinated at any time. And that was a population that we really started vaccinating with in the country. So they've had it available to them longer. Now that the vaccine is really available to everyone 12 and up, we're not seeing those numbers in the younger population, but they are part of the global population. So when we talk about that 70 to 80% number to develop herd immunity, we need that younger population to be part of that. And it's good citizenship.
Yeah.